Hello, my name is Dr. Syed Junaid. I'm a consultant radiologist at Acorn Ultrasound. Let's talk about groin ultrasound. At Acorn Ultrasound, we are nationally recognized experts, and therefore you can feel confident in our services. The two major reasons why we scan the groin with ultrasound is A, the patient may complain of groin pain, or they feel a lump within the groin. One of the commonest reasons for doing an ultrasound of the groin is to exclude a hernia. A hernia can present with pain, lump, or both. A hernia is a defect typically in the abdominal wall through which abdominal contents protrude through. Typically this is abdominal fat or sometimes bowel. The most common hernia is an inguinal hernia followed by a femoral hernia. These are both groin hernias. And in older patients, especially men, the hernia can actually travel down from the inguinal canal and into the scrotum, and so they can present with large scrotal masses as well. The good thing about ultrasound is that because the hernia is very much positional dependent, you may find that the lump gets larger when you strain or you stand up, and therefore with ultrasound, as it's a dynamic test, we will typically ask you to apply pressure into your abdomen to make any lumps and hernias stick out much more, and this makes our confidence in diagnosing them much more than, say, other modalities such as MRI. Apart from hernias, we can also look at the hip joint to see if there is any fluid or effusion within the hip joint. There are also hip flexors, the main one being the psoas tendon, and that attaches near the hip joint, and we can assess the psoas tendon as well as the other hip flexors fairly well with ultrasound. These hip flexors can also develop something called bursitis. Now, bursitis happens in bursas, which is normal areas of fluid which help with gliding of the tendons. Now that fluid can get inflamed and can be a source of pain. There are also lymph nodes within the groin. Typically these are normal, and we can assess them to see if there is any change for cancer within these lymph nodes, and especially if there's a rapidly enlarging groin lump, we definitely want to have a look at it with ultrasound to ensure there is nothing sinister about that lump. We also assess the inguinal canal, which is what carries the spermatic cord and vessels from the abdomen into the testicles in men and the other ligaments in women. In some instances, the ultrasound does not diagnose the patient's groin pain, and in those cases, we would recommend getting an MRI. I hope you found this video useful. For any further questions, please contact the clinic or visit our website. Take care. Bye-bye.